Let's Talk Prevention Idaho. This podcast is a production led by the statewide nonprofit Community Coalitions of Idaho, or CCI. Here at CCI, it is our job to support the work of prevention across the state of Idaho. Through education, training, and providing valuable resources, we help make the work of prevention happen all across Idaho. This podcast will update listeners on what CCI is doing from week to week, as well as provide information for vital professionals in Idaho and across the country. Welcome everybody to yet another edition of Let's Talk Prevention here in the great state of Idaho. My name is David Phillips. I am the Executive Director for Community Coalitions of Idaho, and we are the coalition that sponsors this podcast. Can't forget all of the amazing partners and prevention coalitions across the state that do the actual work of keeping our communities safe and drug-free as possible. Today we have a really cool opportunity to speak to someone from Colorado, a Dr. Ken Finn. Now we got a chance to I got a chance to first meet Ken Finn when we had a NOAC this year. When Jermaine brought the Northwest Alcohol and Substance Abuse Conference back to Boise in person. It was a great opportunity to learn and to connect with other people, and we got a chance to meet Ken. I know Ken has a lot of connections here in Idaho, but with CCI regaining our ground and momentum and getting our feet up underneath us, it was neat to start to really latch on and meet some impactful, powerful people that can help us continue to learn about and educate ourselves on how we can impact this marijuana legalization craze that has been sweeping the nation, but Idaho has remained strong. We have remained strong. There's no legalization, and we have no problems, no qualms with being the lone island in a sea of crazy. So thank you, Ken, for taking time out of your busy day. I see you sitting there in the doctor's office in scrubs, so I'm sure that you've made some of your busy time available for us. I really appreciate it.
Thank you for having me. More than happy to help educate.
So give our listeners a quick synopsis on your background and credentials so that we can, if they're not aware of you.
You bet. Well, thank you. My name is Ken Finn. I'm a practicing physician in Colorado Springs. I've been practicing here for over 27 years. I went to the University of Utah for my residency in physical medicine and rehabilitation back in the early to mid 90s, but I've been in Colorado since then. I practice pain medicine primarily. The bulk of my patients have non-surgical spine conditions. So I help with coordinating of care, managing medications, referring to other specialties, ordering imaging, electrodiagnostic testing, etc. But when Colorado voted to legalize marijuana for medical use in 2000, it was somewhat dormant for many years, and then through a lot of politicking, became much more prevalent. So as part of my background and training, I'm board certified in rehab medicine, I'm board certified in pain medicine, I'm board certified in pain management. I am currently the president-elect of the American Board of Pain Medicine, and I've been on their exam council for many years, which is the organization that wants to raise the bar, so to speak, on providers that want to take care of patients in pain. I served on Colorado's Governor's Task Force on Amendment 64, which legalized marijuana for recreational use, in the Consumer Safety and Social Issues Work Group, and spent 4 years on the state's Medical Marijuana Scientific Advisory Council. So I speak nationally and internationally on my experience and my knowledge of cannabis. I was the editor of a medical level textbook called Cannabis and Medicine, an evidence-based approach, with 70 authors from 4 countries and 20 chapters. And I'm the co-vice president of a new organization, a 501c3, called the International Academy on the Science and Impacts of Cannabis. And we have members from Europe and US at this point, and we're continuing to grow because we're only new this year. So back to why I got into this is I was seeing over time an increase in patients that were presenting to my office on very high doses of narcotics and opioids, and their levels of pain were very high, 10 being the worst pain ever or imaginable. They were saying their pain levels were 7, 8s, 9s, and 10s. And they were also using marijuana for their pain. So clinically, it didn't make any sense as to, well, what is it really helping? Is it not helping? Why are you still on opioids if it was that great of a pain reliever? So I started doing a lot of reading and educating myself on cannabis and the plant and the science, and does it help with pain relief? Is it a good opioid substitute? But the data is becoming much more clear over time that it has not been proven to be a good opioid substitute. It has not been proven to be a good pain reliever. And in Colorado, we've had an ongoing increase of drug overdose deaths over time, which significantly worsened after we had de facto legalization before full-blown legalization. In 2009, when the dispensaries blew up everywhere, and you couldn't throw a stick without hitting a marijuana dispensary. And then since legalization, it's even gotten a lot more worse. And so if you look at the data in Colorado, the expansion of medical and recreational marijuana programs here in Colorado have had no impact on our drug problem, and more likely than not have been fueling it as an overseer of this drug problem, because it's a gateway drug. People tend to start with marijuana and alcohol before they progress to other more dangerous substances like opioids and fentanyl. So I think it's critical that people look at the evidence and look at the science, because in this day and age of COVID, that's what you hear about is, follow the science, listen to the doctors, look at the evidence, where actually there's no evidence, especially in the products that people can purchase in the dispensaries. The products are highly variable in terms of THC content. They're highly variable in terms of other adulterants or potential contaminants. They're poorly regulated, poorly tested, frequently contaminated. So I tell my patients that come in using marijuana products to be careful, because what's in the bottle may not necessarily be what's on the label, and vice versa. I've had patients that have products, there's nothing on the label in terms of THC content, yet when we drug test them, they're positive for THC, but they swear that their product has no THC in it.
Yeah, that was something we spoke with an ER doctor in Southern California years ago who was treating his daughter with CBD products for her seizures, and he said that the most infuriating thing about the process of trying to treat his daughter with alternative medicine was the fact that he could not get someone to just clearly label what was in the product. Like he always felt like he was playing Russian roulette with his daughter's treatment. And that is a scary thing, because nowadays we heavily rely on packaging, ingredients to tell us what we're putting into our bodies. And when we're not even going to a pharmacy, we're going to a dispensary where some de facto bud tender is acting as a medical professional dispensing something that they're claiming is medicine. That can be very scary, right?
It's very scary. And if you just look to the west of Idaho and Oregon, the state of Oregon actually audited their marijuana program a few years ago. And they concluded that they were only able to inspect 3% of the state's stores and 1/3 of the growers for compliance, which to me is a big fail. And the conclusion out of the state of Oregon, which has had a very robust medical and recreational programs for many years, they concluded that they can't guarantee the results of testing are reliable, and they could not guarantee that the products were even safe for human consumption because of the contaminants. And so you're talking about directly west of Idaho in Oregon, their marijuana programs have completely failed. Yet they continue to churn out all these marijuana businesses and products, and just disperse them not only across the state of Oregon, but also to other states that may not have programs. There's a lot of trafficking going on of marijuana across the country. So if Oregon can't do it right, Colorado can't do it right. I mean, we've had recalls on products that have had arsenic in it, cadmium in it, other yeasts and molds. I mean, other states are failing hand over fist, and they say, well, if we just legalize it, it'll be fine. Well, that hasn't been the case in any state to date.
Nope.
Nobody's doing a good job regulating this monster industry, and it's merely just another addiction for profit industry. I mean, we've done a terrible job with the current legal drugs we have, like tobacco and alcohol.
Yeah, we just recently have started to feel like we're getting close to catching up to the head, and then we found out at the conference this week that the industry is even changing fast. The alcohol industry is changing faster than some of the giants can even keep up with, that have been doing it for, century, as long as commercial alcohol has been sold. And if they can't keep up with it, how are we supposed to keep up with it? One of the things that you addressed in your presentation that I thought was interesting was talking about marijuana and it just being a plant, this harmless little plant. That why are we so scared of a plant? Can you talk about that?
Yes, yes, it's the marijuana plant has been around for eons. I mean, people will discuss about Chinese pharmacopoeia, that the Chinese were using cannabis sativa for different ailments and documenting 3000 BC on the benefits of cannabis. They've had documentation of Peruvian mummies that had cannabis in their GI tract. So the plant has been around forever. And so the products, however, that people have access to now have not been around forever. The quote, God's plant that existed 3000 BC really doesn't exist anymore in any state, for that matter, because the THC content of God's plant from thousands of years ago was about 2 to 4% THC. The average THC content in the smoked bud flower in Colorado is about 17 to 20%. So nearly over 1,000 times more potent. And then you get into the concentrates that are pushing 40 to 60% THC, and these dabs and waxes and shatters that are now available in dispensaries, both medical and recreational, don't even resemble a plant. They don't have stems and leaves and flowers. They're gooey substances. The way you ingest them or get this substance into your body is heating it on a nail with a blowtorch and vaporizing it. I mean, that is not plant-based medicine. I mean, we have a gazillion plant-based medicines already. I mean, aspirin has been around for decades, and that was isolated from the willow tree, the bark of the willow tree. We have digitalis for people that have heart issues. We've got chemotherapy agents. We have a lot of plant-based medications, but they've gone through a process to get to where they are as a medicine. They go through study, they go through what are called phase 1, 2, and 3 clinical trials through the FDA. They're purified, they're not contaminated, they're proven to be effective, but somehow marijuana got a free pass. They're calling it medical marijuana, but it's using a plant that has been modified over the past really 10 to 20 years. I mean, the track record of the products that we have now is very new. I mean, the track record of tobacco and alcohol go back, decades and centuries.
Yeah.
These new products are relatively new in the past 6 to 8 years. I mean, they never heard of a 100% crystalline THC product until recently, that people can heat with a blowtorch and vaporize, and the amount of THC you can get in one hit is, depending on where you read, the equivalent of 40 to 60 to 80 joints in one hit. That is a lot of THC to get at one time. And the long-term effects, I mean, we are completely in uncharted waters. We do not know what the impacts are going to be on the human body on the adolescent and developing brain, or in the developing fetus, when you have women who may be using during pregnancy for their nausea or whatever ailments they may have. Their back might hurt. But just the data point is, 70% of the dispensaries in Colorado recommended women use during pregnancy. And again, that brings to your point, the person behind the counter in the state of Colorado does not need any medical background or training, yet they're working in a medical facility and they are giving medical advice, and the state won't do anything about it.
And something else that I think came up in your presentation at NOAC this year was the percentage of people that are claiming to be there for severe pain, but they're really not, like the disproportionate use of, I'm in extreme pain, I just need marijuana, doctor write me a script, without any real diagnosis of where that pain is coming from.
Correct. I mean, that's kind of the whole difficulty with the medical marijuana program is 90% of the marijuana recommendations in Colorado are for pain. Yet, despite that fact, our drug deaths continue to rise. So if it was that good of a pain reliever and most of the medical marijuana patients are using it for pain, you would expect the number of opioid related deaths to be on the decline. Yet they are on the incline, and they are skyrocketing, especially during COVID, because COVID had a significant impact in substance use with alcohol and tobacco and marijuana, most in particular, along with other substances, but not nearly as much as marijuana and alcohol.
Yeah, well, they were deemed essential, right?
Well, they were deemed essential. I mean, but you have people that, not everybody that smokes marijuana is going to become depressed or suicidal or psychotic. But COVID had a significant impact from a mental health perspective, and people may be using marijuana to cope. But if they are in that percentage that have a problem with their use of marijuana, they couldn't get help because treatment centers were shut down, drug courts were shut down. Yet our governor recommended and allowed marijuana businesses to remain open because they considered it an essential business.
Yeah, we learned at NOAC from one of the directors of a state alcohol. They did that to make sure that people didn't travel across state lines to go get their products. And so listening to that and looking at the consequences, it was like, wow, that year was even hard. Last year and a half was even harder than it was going through it. It was learning the reasons why we did certain things and had these consequences. It was horrible.
And I think the most vulnerable population were adolescents.
Yeah.
They clearly got hit pretty hard because the schools were shut down. They were isolated. They were going to school online. And a young person can have a real difficult time with change like that, and a complete restructuring of their day-to-day activities can be very draining on a young person who may not be able to cope as effectively with these things that we had to go through in COVID.
So something that we asked Aubrey that I wanted to ask you, because it really seems like for the last 10 years, people have not gotten it through their heads, the dangers of the actions that they've taken when it comes around legalization. And I was wondering, what do you think is missing from the message that we need to get out to people that can really start hammering this home? Because if we don't, we're not looking for a very bright future, are we?
No, I think the future is somewhat dark. And I do commend the people in Idaho for being the last stronghold, because you're surrounded by Canada and Washington and Oregon and Utah and Wyoming and Montana, all of which have marijuana programs. And you are the only state of only a few remaining that is really an island surrounded by marijuana states and even Canada. So I think the message that needs to be heard is that Number one, marijuana is not safe. Um, Not everybody that uses is going to have a problem, but when you normalize substance use, more people are going to use. And even if the percentage of people that have problems, say it's 10%, just by the sheer volume of numbers of people using now, that 10% is still going to be maybe still 10%, but 10% of 100 is a lot lower than 10% of 100,000.
Yeah, and it's we are seeing the consequences of being so surrounded by states. But what's nice is that it seems our youth are still. We had some companies running commercials around 420 that were playing with a theme, and we had multiple youth say that was gross. Why'd they do that? So it's nice to know that our young people are still not completely swayed by this pro pot culture. But something that you showed us at, I believe it was you showed us at NOAC, was a Nerds Rope infused candy product. And can you talk about how one side of the package had a different message than the other side of the package when it came to what was in the product?
Well, and that's part of the whole problem, is that this particular candy was an actual legal medical marijuana product that was very cartoony, very attractive to children, colorful. One side of the package said that it had 500 milligrams of THC in it. On the other side of the package, it said 420 milligrams of THC in it. So somehow that passed the muster of the state, number one, and clearly mislabeled. I mean, does it have 500 milligrams? Does it have 420 milligrams? Were they just poking fun at the 420 holiday? Does it have 1,000 milligrams in it? Does it have only 100? We don't know. And the concern is that that product was purchased by a 12 and 14-year-old via Snapchat, because that's how kids are dealing drugs these days. And it's not just marijuana; it's fentanyl and other opioids and illicit substances. And it's frightening what our young people have to contend with these days. I certainly wouldn't want to be a teenager in 2021.
No, it's getting harder and harder to be a young person and not fall victim to the many trap holds that are laid before you. I mean, yeah, I agree with you. I couldn't be a teenager now, and I'm getting ready to raise one, so pray for me. So, is there anything else that you would like to share with our viewers before we finish up? I feel like I've been talking about marijuana all day long.
I can talk for hours, as you know. I think the things that people have to be aware of, and I think the data that has to be promulgated to your state leaders, your local and community leaders, are the facts that what is happening. When I presented to South Dakota legislators a couple of weeks ago, and I really gave them a very abbreviated version of what I talked to you guys about. One of the legislators commented, he said he thanked me for the front row seat to the horror show, which I took as a compliment, because I'm telling you, lay people, state leaders don't know what's happening. All they hear from the industry is you're going to make a lot of money, and you're going to alleviate pain and suffering of these seizing children and grandma with cancer. They will parade them on the TV until they get what they want and the bill gets passed. I can tell you, we don't hear about the seizing children and grandma with cancer anymore. They've already served their purpose in Colorado. But what's going to happen is you're going to see an increase in healthcare utilization at what known cost, because we already have a very taxed healthcare system. You're going to see an increase in marijuana-related driving fatalities. You're going to see an increase in adolescent use, addiction, and treatment. You're going to see an increase in the environmental impacts, where people will be growing, and I'm sure they're already growing in the Boise National Forest. Illegal marijuana grows, and in California, like I said in my presentation, just to clean up California from the marijuana industry in the national forest is about $70 billion. And as a reference point, the BP oil spill was only $60 billion. And that's just California. So you're going to have all of these now known consequences. When Colorado went through this, we had what people were describing as unintended consequences. People didn't know that we were going to see all these problems associated with the marijuana business. And I really think you need to call out any of your state legislators that are pushing for this, that they cannot say, well, I didn't know about this. The data is there, it's readily available. That's why I speak to a lot of states and educate the leaders, saying, this is what's going to happen if you go down this road. So you can't claim ignorance. And what is going to be the societal cost? I mean, there's the data, preliminary data says for every dollar generated in Colorado costs $4.50 to regulate. So it's not a money maker for the state. It's a money loser. I don't know if I completely agree with the $4.50. I think it may be a little less than that, but it's certainly not a money maker for the state. And like any other addiction for profit industry, they make a lot of money for their respective industries, tobacco and alcohol. But we all know what the societal costs have been over time. Yeah. And nobody's been able to explain to me, we're going to add another layer of addiction for profit on top of what we already have, but we'll do better. And nobody's done better. And nobody has been able to show me the data where they have done better. Any state that's legalized for medical purposes, number one, it's a toehold for legalization. It's just the entree to legalization. But even the medical marijuana states have done a terrible job with regulating the industry and have created another disaster, public health disaster and concern.
Yeah, that always gets me when they talk about, well, tobacco and alcohol are bad, if not worse for you. Why? But those are legal. And I'm like, so we're going to throw, since the fire's already burning, let's throw gasoline on it now. Like, I've never understood how people hear that and they're like, well, that's true. No. And maybe it's because I'm not as heavy a drinker and I haven't smoked in forever. But I really don't understand that logic. It's mind-boggling to me when I look at people hear that and this wash of understanding flows over them. I'm like, what are you talking about?
Well, it's very interesting because, one of the platforms to legalize it will help our drug problem, and clearly it hasn't happened in any other state. The other argument and platform to legalize is like, well, give the people the choice between alcohol and marijuana. It may be safer. They're claiming it's safer than alcohol. So that they claim these things out of one side of their mouth, and then they talk about these other things out of the other side of their mouth. But if you look at the Colorado data, since we legalized, people are drinking more. They're not drinking less. If you look at the Colorado alcohol tax data, the amount of revenue since marijuana legalization for alcohol has continued to spike. It hasn't leveled off or decreased. So people are not smoking more and drinking less. They're smoking more and drinking more.
So they're just getting more, taking in more of their demons all at one time.
Well, and that's the other thing, is that the polysubstance, in the marijuana-related driving fatalities, it's typically polysubstance. But 33% of the people that die in a marijuana-related fatality, 33%, it's marijuana only. And so, but people use all sorts of stuff. They drink and use benzodiazepines and opioids and marijuana. So we really don't have an opioid crisis in this country. We have a drug problem. We have a polysubstance drug problem, and it's just getting worse. And marijuana hasn't helped. In my opinion, marijuana is the overseer of our drug crisis. It's been quietly watching our drug problem get worse. And everyone's like, well, if we let marijuana in the room, it'll get better. And it hasn't.
No, it has not. Well, Dr. Finn, I really appreciate you taking some time out of your day to speak with us on this very important issue. And I'm sure there's going to be more opportunities down the road as we are battling multiple initiatives to legalize both medical and recreational marijuana use in the state. So keep your phone close, because I'm sure we're going to need a few more moments of your time throughout the next year and a half.
Yeah, well, thank you. Consider me a resource.
Well, so guys, that's Dr. Finn. And if you guys didn't get anything out of that, get the fact that this is not going to turn out well for Idaho. None of the benefits that they say are actual benefits. You are not going to have a healthier community, and you are not getting medicine. We do not vote on medicine. Medicine is tested, regulated, and then deemed safe and spelled out very specifically what the consequences are for these medicines. I mean, you hear time and time again on television, another drug being advertised in the laundry list of complications that may derive from this use this medication. Never once have you heard your bud tender say, you might go into a psychotic break. He's just going to tell you, this is going to make you feel real good.
Right.
So let's stop listening to potheads selling us lies, and let's finally, for once and for all, tell these initiative people that we do not want their fake science in Idaho, and they need to take it somewhere else. And then let's work to help our partners across the state levy off of our strength and continue to roll back on the policies that have been blowing their states apart. So I want to thank everybody for taking the time to listen to this podcast. Remember to share it with whoever you think needs this information. And if you don't think they need this information, share it with them anyway. All right, guys, have a good day.